Hello, I'm Paul Peterson, and welcome to Aging Well in LA. Today we have a very important show for you. Have you ever heard of the California Coordinated Care Initiative? Well, you should if you're on Medi-Cal or Medicare, because these are coordinated benefits now. We are implementing Senate Bill 1008 and 1036. We have a genuine expert on hand today to help guide you through this process because there are mandatory provisions and opt-out provisions. So please stay tuned as we discuss CCCI today on Aging Well in LA. Welcome back to Aging Well in LA. Our topic today, the California Coordinated Care Initiative, CCCI. And with us, a friend of the show for long-standing, is Eileen Harper, who is the Executive Director of the Center for Healthcare Rights, and not incidentally, something called HICAP, a Health Insurance Counseling and Advocacy Program. Did I get that right?
That's correct.
Well, welcome once again. So we have a new program going into effect very shortly. Can you tell us exactly what CCCI is?
Okay, well, the California Coordinated Care Initiative, which is CCI, is essentially an initiative that California has embarked on here in our state. And the goal has a couple of key components.
Okay.
One goal is to create a program that would coordinate Medicare and Medi-Cal benefits within a managed care setting for people who have both Medicare and Medi-Cal.
Right.
And that component is called CalMedi-Connect. Another component is to require folks who are adults who have Medi-Cal and Medicare, if they don't select a CalMedi-Connect plan, they would be required to enroll into Medi-Cal managed care plans. And the third component is to move Medi-Cal benefits that have been available through fee-for-service Medi-Cal into Medi-Cal managed care. So the CCI has three key components. Probably the most prominent component, though, is the CalMedi-Connect program.
I see. Now, what the interest here is to streamline the care for people and hopefully to reduce costs, correct?
Well, I think the goal of the CalMedi-Connect program is twofold. One, to create an integrated care model for people with Medicare and Medi-Cal. Right now, people with Medicare and Medi-Cal aren't required to enroll in managed care plans, and therefore they can get the care any way they want to. These folks generally have multiple medical conditions. They get a lot of hospital care, a lot of doctor care, use a lot of prescription drug. So I think one of the goals is to, by moving them into a managed care model, their health care would be managed by a primary care doctor, their specialty services would be managed, and I think the goal is to enhance the quality of care they get. The other goal is that, as you know, California has a budget situation, and the Medi-Cal program is relatively costly, and so the secondary goal would be to try to reduce the costs and the amount of money that we spend on the Medi-Cal program. Right.
Now, we actually caught a break for a demonstration program. The start date on this, the trigger date, has been moved off a little bit from the October 1st date, correct?
That's correct. Now we're looking at no sooner than January 1st.
Okay. And California is actually taking the lead on this. We were one of the first to jump in on the Affordable Care Act, and this is a demonstration project that's going to touch, the estimate in LA County was 200,000 people?
Yeah, in terms of the CalMedi-Connect population, 200,000 people are eligible for CalMedi-Connect in LA County. The statewide estimate, you have to keep in mind that LA County is just one of the 8 demonstration counties.
Right.
So the total population is 546,000 people if you include all the counties. So you're right, California would have one of the largest demonstrations in the nation.
Well, it's actually a good idea to start a little smaller. I mean, 500,000 people is a bunch.
Yes.
Now, how is this going to be administered? Oh, and I should tell you, Later in the program, we're going to have actual demonstrations of this with lots of numbers, so get a pencil and paper ready. You'll want to copy some numbers. How is this going to be initiated? How are people going to find out more? How do they enroll?
Okay, good question. Well, if we start January 1st, if that happens, then the notification process where people start getting information about this would start in October of 2013.
Gotcha.
So they would get information over a 98-day period. So they would get their first notification in October, they would get their enrollment packet in November, and then their final notification in November. I'm sorry, in December. In addition, the state plans on having a outreach campaign to also sort of supplement this information process.
Sure.
So once people get their information, particularly their enrollment packet, essentially it's important that they understand that they would have a couple of different options. They can either choose to participate in Cal Medi-Connect, so the enrollment form will have a section that says, yes, I want to participate in Cal Medi-Connect. And then there will also be an opportunity to what we call opt-out. Say, I don't want to participate, I want to keep my Medicare the way it is. So essentially the enrollment form is to be used to identify which enrollment option you want. So if you say, yes, I want to be in Cal Medi-Connect, then you would participate, your Medicare and Medi-Cal would be assigned to a Cal Medi-Connect plan.
Gotcha.
If you say, no, I don't want to participate, then your Medicare stays the way it is, but you still must select a Medi-Cal plan.
Right, I've got you. Now, these are the kind of changes that can be very troubling for seniors. There are going to be lots of questions, no doubt. How do people get more information? How do caregivers, for example, on behalf of a senior who may not be able to comprehend all this, who do they call? How do they get the information they need?
Okay, well, that's a really good question, and I think what you're pointing out is very important, which is we're really talking about educating a huge number of people, many of which may have dementia, may have a mental illness, may have literacy issues or other cognitive impairment. So I think this is going to be a very big challenge, and one of the things that our organization is doing, our HICAP program is doing, is trying to educate people now so that they have a baseline understanding of what some of these changes are going to be, when they'll happen, and what choices they'll have to make later this fall.
Okay, so, well, we know people can always call the Department of Aging right here in Los Angeles. That's a very simple process, and the number's there on your screen. But they can also get in touch directly with HICAP and your organization.
Of course, of course. If people want to give us a call now to sort of have a sort of better understanding of how these changes are going to affect their Medi-Cal and Medicare, what's very important that they need to understand is nothing is happening now. There are no changes right now. They don't need to do anything right now, but if they want more information, they should call our 800 line.
Right. You know, for seniors, the complexity of the health delivery services is really sometimes overwhelming.
Of course, yes.
And there are many issues. Transportation, how do I get to the doctor? Who do I talk to? Because I'm concerned about my medications. Maybe I shouldn't be taking them together. This is going to be an ongoing process.
Yeah, and I think that, you know, if you look at the Cal Medi-Connect program, I think one of the goals is to try to help seniors, younger person with disabilities who have both Medicare and Medi-Cal, help them essentially move into a healthcare setting that will help them with those types of issues that you've just raised.
Great. Eileen, thank you so much for being with us.
You're very welcome.
I know this is going to be a very rocky road here, but people shouldn't be alarmed. Help is available, and we'll all manage this together. Eileen, thank you so much for spending time with us today. I feel reassured. There are experts available.
All right. Well, thank you for inviting us.
One of the great features of HICAP is that if you have a concern, you can pick up the phone and call the Center for Healthcare Rights and actually get someone to talk to.
Hello, my name is Lanulka Thomas and I'm a counselor with the Center for Healthcare Rights. Our agency is the HICAP for Los Angeles, and we provide free help with Medicare and Medi-Cal questions. I understand that you have some questions regarding changes in your Medicare and your Medi-Cal.
Yes, I'm really confused.
Okay, yes, I know these changes are confusing, but I think that I can help you understand the changes and how they'll affect you. First of all, there'll be no change in your Medicare and Medi-Cal until at the earliest, January 2014. In addition, these changes affect only people who have both Medicare and Medi-Cal. Do you have both?
Yes, I do.
Okay, so you have Medicare and Medi-Cal. So let me explain how the changes affect you. During the period of October through December 2013, you'll receive information about new plans called Cal Medi-Connect plans. These plans will be new Medicare and Medi-Cal plans. If you enroll into a Cal Medi-Connect plan, you'll receive all your Medicare and Medi-Cal benefits through the new Cal Medi-Connect plan.
Why would I?
Okay, why would you want to join a Cal Medi-Connect plan? Well, you may want to join if your doctors participate in the new plans and if your prescription drugs are covered by the plans. In addition, the plans will offer dental, vision, and transportation services. You don't have to join a Cal Medi-Connect plan. Enrollment is voluntary. You can keep your Medicare as it is now, but if you don't join a Cal Medi-Connect plan, you'll be required to enroll into a Medi-Cal HMO.
Well, do I have to make these changes right away?
No, you don't need to do anything right now. You'll get more information about Cal Medi-Connect starting in October 2013. If you have additional questions about the information you receive or your enrollment choices, please do not hesitate to contact us again. You can reach us directly at 1-800-824-0780.
Thanks.
Okay, thank you for calling us.
We're here at the St. Barnabas Senior Center to watch a presentation given by Cristina Garcia of the Center for Healthcare Rights. This is the HICAP I mentioned to you earlier.
Good afternoon, everyone, and welcome. I'm here from the Center for Healthcare Rights. We are a nonprofit advocacy organization, and we provide assistance for beneficiaries with Medicare and Medi-Cal insurance. So this afternoon, we're going to talk about the changes that are occurring in the California insurance programs. So let's begin with our first slide, talking about what is Medicare and what is Medi-Cal. Both are health insurances, and they both provide assistance when you visit your doctors, your hospitals, when you need medications. One, the Medicare is the federal program, and the Medi-Cal is the state program. When you have both insurances, you don't pay any of the deductibles, any of the cost sharing that has your Medicare insurance. So it's very important to be familiar with these insurances. And now we can proceed talking about a new program called Cal Medi-Connect. What is this program all about? This program is going to affect both of your insurances, your Medicare and your Medi-Cal. Now remember, because they're two different programs, you're going to have different alternatives or options. Let's start analyzing what are your options with your Medicare. First, you have the ability to choose to participate into the Cal Medi-Connect. And what does this mean? It means that you have the ability to select a plan. Your second alternative is if you receive notices and if you do nothing, then what happens is Medicare will select a plan for you. What's very particular about the Medicare insurance is that you will have a third option, and that option would be filling out the form that you received and selecting opt out, which means leave my Medicare just the way it is. I don't want my Medicare coverage to change. Let's move on with the Medi-Cal portion. And what is going to be different than the Medicare is that all people with Medi-Cal have to or must enroll in a Medi-Cal HMO plan. So even if you have full Medicare benefits, your Medi-Cal has to be with an HMO plan. But you also have alternatives, and you can be proactive about it, and that would be you can choose which plan you want to be in, whether it be an HMO with LA Care or an HMO with HealthNet. You select your option. And if you receive forms and you do nothing, then Medi-Cal will pick a plan for you. As with every rule, there are exceptions. And there are two groups that will be exempt from this demonstration or from this Cal Medi-Connect program. They are the exempt population, which are people that have already HMOs. You don't have to worry. However, if you do receive the notices, just make sure you select opt out to stay with your current insurance. And the excluded populations will not receive notices. However, if you do receive notices, you are people that live in veteran homes, people that have other insurances, people that have or are in dialysis center or have ESRD. So let's analyze the key points of Cal Medi-Connect. The first one, it involves people with Medicare and Medi-Cal insurances only. So if you have Medicare only, this does not affect you. If you have Medi-Cal only, this program does not affect you. Remember, it's only for both people with Medicare and Medi-Cal. The second point, you do not need to enroll in any plan at this time. You do not need to change your coverage. You can remain in your coverage that you have now until you get notices. Those notices will come to you between October through December of this year. The change is expected to start in January of 2014. But remember, you will be notified 3 months in advance. Then another key point about this is that these plans or these HMOs that you will be enrolled into are new plans. They are LA Care and HealthNet, but they're not the regular LA Care and HealthNet that you currently know. They have hospital benefits, medical benefits, lab works, medication coverage, and in addition, they will offer transportation, vision, and dental coverage. Now, if you have any questions when you get the notices, please do not ignore them. Those notices, read them, and if you don't understand them, feel free to give us a call. Our phone number is on the screen, 1-800-824-0780. We're here to help you. Thank you for coming to the presentation. Does anyone have any questions at this time?
I'm concerned. What will happen with my coverage? Will it change?
You don't need to change your medical insurance now. You can continue seeing the same providers and same doctors you have been seeing. However, when you do get the notices, read them, analyze them, and then you can make a selection.
Do I have to change my insurance coverage now?
That's a very valid question. And I have to say that your benefits are not changing. Your providers might change if they don't accept the new insurance coverage. However, remember, your Medicare is your main insurance. It always determines where you go. So if you don't want to change your doctors, just make sure your Medicare remains the same. Your Medi-Cal is your secondary insurance. It covers the 20% copay. Medi-Cal will pick up the difference if you join an HMO plan, but if your doctor doesn't take that plan, they will bill you, or he has the ability to send that claim to the HMO plan.
Who can I call if I have questions?
So if you have any questions, you're more than welcome to give us a call back. And our number is on the screen, 1-800-824-0780.
Time now for good advice for seniors and their caregivers on Caregiver Corner with Susie Rodriguez Shapiro.
You know, inside every older person, there's a younger person thinking, what the heck happened? Yes, as we get older, we find that we go through many different changes. Some are physical, some are emotional, and we need to adapt to them. But adapting to those changes often relates to how society views aging. We find that now the image of the older adult who's feeble and sick is no longer the truth. With more and more baby boomers aging and getting into the older adult segment, we find that they're more demanding, they're more vocal, they're better educated, and they're certainly more involved in society. But as we start to look at what we need to consider, we see that there are changes in us and also in our loved ones who are older than we are. And we need to start adapting to figure out how are we going to handle situations. We find that we tend to feel young when we're feeling happy and pain-free. But then when we're sad or in some kind of discomfort, or sometimes just trying to act too young, that's when we start to feel old. But we look at the changes that we're going through and see how can we best suit the timing that we're in. For example, social changes, changes in work environment. Retirement can be very positive for some people, but can also be a time of loss. People often identify by who they were in their work environment, the social economic status that they had because of that employment, the social networking that they had. But now they're adjusting to new financial situations, a new environment around them, and sometimes just even being around their partner a little more than they were used to being. One of the things that is common as we get older is that we find ourselves in our position of caregiving. And people think, I'm not a caregiver, I'm a daughter, I'm a son, I'm a grandchild. Oftentimes it's important that we start looking at how to care for ourselves, because as we're coping with some of the changes that come from our role as caregiving, we need to remember how important it is to take care of ourselves and not put ourselves on the back burner. If we're not feeling well ourselves, and if we're missing doctor's appointments for ourselves, we're no longer in a good condition to be able to provide the help that's needed by our family and loved ones. So remember how important it is to take care of yourself and get support. Getting help from neighbors, family, friends, support groups, all of those are very valuable to ensuring that your role as a caregiver is best met. So in conclusion, we remind you to applaud your efforts, acknowledge the good things that you've done, take time for yourself, and when all else fails, remember to use humor and take deep breaths to help you get through it. And with that, we'll see you at the next Caregiver's Corner.
With us today is Laura Trejo, who is the General Manager of the Los Angeles Department of Aging. Laura, there are some changes coming with this new HICAP program. For people who are already in the program, there are very few changes, but for those folks about to enroll, how can the Department of Aging help them?
The managed care plans are going to be doing very assertive outreach in the community. I encourage seniors to go to the learning opportunities that will be presented. There'll be a lot of material. They can call the Department of Aging and we'll be happy to work with them in terms of identifying what choices are best for them. This is really going to be trying to help seniors and their family members make the best healthcare decision for themselves.
Laura, with people who have significant issues, complications, who need home-delivered meals or have transportation issues, what can you tell them about these new services?
Part of what California is really trying to do with a lot of the programs that are going to be rolling out in the coming months is to really provide more coordinated and integrated care for those who need it the most. When people have multiple chronic health conditions that they're managing, they have multiple needs of different types of services. These new changes that are coming in healthcare, in managed care, really will provide a continuum of services and will basically work with the seniors to have a more coordinated approach to the services they're receiving. And we want to encourage them, both through their managed care organizations that will be in the community and through the Department of Aging. We also have our excellent HICAP program, and we want to encourage people to utilize that service as often as they need to get the types of information they need.
Wow, exciting times ahead.
I think so.
Thank you, Laura.
Thank you, Paul.
Well, I hope you found today's show as interesting and fascinating as I did. We want to thank our friends at St. Barnabas for letting us come in today to watch the HICAP presentation about the new California Coordinated Care Initiative. This kind of information is going to be very important. Thank you so much for joining us on Aging Well in LA.